usapang may kaugnayan sa kalusugan naman po tayo. Ang cerebral palsy po ay isang motor disability kung saan apektado po ang abilidad ng isang tao sa kanyang postura, balanse at paglalakad o paggalaw. Ang ibig sabihin po ng cerebral ay brain, habang ibig sabihin naman ng palsy ay kahinaan sa kalamnan o muscles. At upang mas alamin pa natin ang patungkol sa cerebral palsy, ating po makakasama ngayong araw si Dr. Mirna Fojas, isang pediatric neurologist. Dr. Fojas, magandang umaga po sa inyo. Rise and shine.
Good morning din sa iyo.
Dr. Fojas, si Diane Kirar po ito. Doktora, bakit po ba nagkakaroon ng cerebral palsy ang mga bata? At ano-ano po ba ang mga posibleng sanhi po nito, Doc?
As defined, no, this is because of a brain injury, usually occurring in a developing brain. So, kunyari, buntis ang isang ina. Kunyari, may nangyari may congenital defect or may genetic abnormality na yung bata, no, at naapektuhan yung brain. That could be a cause of cerebral palsy. For example, nagkaroon ng bleeding yung nanay, tapos nagkaroon ng stroke. Yung fetus, no? Yun, nagkakos ng cerebral palsy. So any injury to the brain of an infant or a developing brain of a child during pregnancy or around delivery or shortly after delivery, that would cause cerebral palsy.
Okay. Dr. Fojas, may mga iba't ibang types po ba itong cerebral palsy?
Well, yung types niya depends, no? Kasi ang cerebral palsy can manifest as spasticity, no? So yun ang ating sinasabing spastic CP. Pwede din siyang due to a hypotonia, no? Meron ding mga bata na sobrang lambot, no? You call the floppy baby. That could also be cerebral palsy. And it could be yung chorioathetoid, no? Yung extrapyramidal, wherein they keep on moving. That could be also extrapyramidal CP. Ngayon, there's also such a thing as a mixed CP, a mixture of hypotonia and spasticity. Another way of classifying is also the site. No? So, meron tinatawag tayong hemiplegic spastic cerebral palsy. That means either the left side of the body or the right side of the body is primarily affected, usually with spasticity, or both legs, which is called diplegia, no? Diplegic spastic CP. So, yung classification ng CP depends sa type ng disability. That means either spasticity, hypotonia, or mixed, no? Or extrapyramidal, or the type, no? Meron din quadriplegic spastic CP. That means both arms and both legs are affected. So that is the way we classify.
Okay. Dok, paano po masasabi na may cerebral palsy na po ang isang bata? At ano po yung mga sintomas na dapat pong bantayan, Dok?
Well, as you said, it affects movement, no? Kasi it affects the muscle. Since the area of the brain that was affected is that area of the brain that controls muscle movement. So kung ang bata ay matigas, hawakan, or masyadong malambot, or nakikita mo na delayed ang motor development niya, you might have to suspect CP. Mm-hmm. For example, at 4 months old, hindi pa siya nagte-turn over. Then the patient is delayed, no? So yung motor development niya is is helpful in finding out whether the child has CP or not.
Okay. Dr. Fojas, kailan po yung dapat na pumunta sa doktor para kumpirmahin po kung may cerebral palsy ang isang bata? Ano po yung mga medical screenings na ginagawa po upang ma-confirm na may cerebral palsy na po?
Alam mo, the parents should, or the mother and the father should know, no? Not naman should know. They should know the milestones. When should the child develop this? When should the child turn over? When should the child be able to sit? When should the child be able to walk? No? Tapos pagka hinawakan mo yung baby, kunyari kinarga mo siya, no? Tapos napansin mo na, para siya mag-slip off from your hands, that means the child is floppy. Kasi dapat na-hold niya yung shoulder niya. for you to hold at hindi siya mag-slip sa hand mo. In those cases, the child is probably a floppy infant. Kung masyado siyang matigas, for example, yung legs niya nagsisisors, ibig sabihin, nagko-cross over yung kanyang legs, that is a spastic diplegia. No? So, I guess the best thing to find out is yung kung delayed siya sa motor development niya, then suspect CP.
Okay. Doc, panghuling tanong na lang po, ano-ano po ba yung mga pwedeng gawin ng magulang kung may cerebral palsy po ang kanilang anak at ano po yung mga treatment options para po sa kanila?
Okay, ano-ano ang dapat gawin ng magulang? First of all, siguro you should see a neurologist or a child neurologist or your pediatrician. Your pediatrician can even help you find out whether the child has developmental delay or not, no? Ang treatment niya are varied, no? Unfortunately, CP cannot be cured, no? Kasi may injury sa brain, it's there, natapos na yon, nakikita mo lang yung epekto, no? So there are different things. You can, there are oral medication, depends, no? Kung spasticity ang pinag-uusapan, which in most cases, yun ang ibig sabihin nilang CP, no? Hindi yung hypotonia. Kung meron siyang spasticity, there are several treatment, no? Or something that might help with the spasm or the muscle stiffness, no? One can be oral medication, no? Yung mga baclofen, yung even Valium can help. Unfortunately, there are some side effects, no? There are also some who use injection, yung Botox, botulism injection on the affected muscle. Unfortunately, this is very expensive and you have to repeat it almost every 4 months or every 6 months. Meron ding surgery, no? So, isa ng orthopedic will cut off the muscles, no? The tendons of the muscles or yung tinatawag nating rhizotomy. Abroad, available din ang baclofen, intrathecal baclofen. That means nilalagyan nila ng tube sa loob ng spinal canal and then the medicine, the baclofen is given by pump. And that could help with the spasticity. So yung spasticity, yun ang mga treatment. Yung Botox is an option but very expensive and they have to be repeated. Yung oral baclofen or diazepam can be given but it has, of course, systemic side effect. No? Of course, yung rehab is very important because some has to be taught, no, how to relax the muscle and to use the other muscles. Unfortunately, depende how mild. No? In mild CP, they walk. Children walk. No? In severe CP, unfortunately, they can be bedridden or confined to the wheelchair.
Opo. Doc, maraming salamat po sa inyo pong mga ibinahagi pong impormasyon sa amin ngayong umaga. Muli nakapanayan po natin, Dr. Mirna Fojas. Salamat po, Doc.
Okay, thank you.